Hello and welcome to this presentation where you will be introduced to patient-initiated follow-up. I'm going to talk through what patient-initiated follow-up is. This will be referred to as PIFU throughout the presentation. I will explain what PIFU will look like for you, introduce you to my medical record, how PIFU will work, and then take you through some slides on how you can self-manage and live well. The presentation should take no longer than 30 minutes. There will be some regular pauses in between the slides so you can read through the information provided. Remember, you can always re-watch the presentation whenever it is needed. As you know, your previous appointments have been face-to-face and at regular intervals in the Lymphoid clinic here at Southampton Hospital. Some patients find these pre-arranged appointments very useful and reassuring. However, some patients find these appointments increase their anxiety and are not particularly useful unless they have a new concern or something they wish to discuss. There is also evidence that having a pre-arranged appointment is not increasing your life expectancy, nor does it prevent cancer returning. When symptoms and concerns are reported in real time, they are addressed quicker rather than waiting for a routine appointment. So this is where PIFU can benefit you. PIFU is used widely across oncology and cancer care at Southampton Hospital, as well as other departments in the hospital. Instead of having pre-booked hospital appointments, we will support you to self-manage your care by providing you with a surveillance plan to continue to monitor your condition. For lymphoid patients, this is routinely having blood tests carried out as you normally would if you attended a face-to-face appointment. The surveillance plan is tailor-made to you, will be accessible by you and your lymphoid team once you are registered on the Lymphoid PIFU pathway. The surveillance plan is determined by your diagnosis and the treatment you have received. During PIFU, we will continue to monitor your bloods, and these can be done by your GP or at your local hospital. The dates for your blood tests will be on your surveillance schedule, and a copy will be sent to your GP. This will also be available to you on the My Medical Record. If you are not using the My Medical Record, then a paper copy of the surveillance will be sent to you. If you are being followed up by another hospital, they won't have medical records to review your plan, so please take your copy with you to any appointments. My Medical Record is a secure online electronic patient record that allows you to manage and record your healthcare online. It's accessible from any device which has access to the internet. It helps you to share information with your lymphoid team and allows you to quickly access blood results, clinic letters, your surveillance schedule, lymphoid-specific patient information, and to message your clinical team if you have any concerns or new symptoms. Blood results are generally available to you prior to your clinical team reviewing them. We advise caution when looking at results late afternoon on a Friday or over the weekend, as if you are worried or have a question about a result, you may not be able to speak to one of the lymphoid clinical team until the next working day. You can always message the clinical team, and this will be actioned on the next working day. Please ensure you do contact us if you have any concerns about your results. You can self-register for the My Medical Record using the address on the screen. If you are happy to join the lymphoid PIFU pathway, the clinical team can also register you in clinic or over the telephone. If you would like more information on the My Medical Record, then please do contact us. Once you are registered on the My Medical Record and the PIFU pathway, you'll be able to access lymphoid information under the My Conditions tab. It shows you lots of useful information specific to your lymphoid condition. The lymphoid team will continue to monitor your blood results and your weight on the My Medical Record. This will ensure that any new changes are identified promptly. We also will ask you to complete your weight and a symptom questionnaire. This is available on the My Medical Record, or it will be sent to you in the post if you do not use My Medical Record. We will always contact you if you have identified any concerns on your questionnaire or you are worried about any of your blood results. Remember, you can always contact the clinical team via the messaging service on the My Medical Record page. We will notify you by letter that your surveillance tests have been checked by the clinical team. This may be a physical letter in the post, or the letter will appear in the My Documents section of your My Medical Record account. We highly recommend setting your preferences, which are in the settings, for electronic delivery of letters, as they will be available much quicker than if you are being sent them in the post. You will be enrolled on the lymphoid PIFU pathway for at least 25 years for ongoing surveillance. After this time, we may discharge you to your GP, but we will discuss this with you closer to the time. If you fail to complete your blood test and your surveillance schedule on 2 occasions, we will bring you back to clinic just as a safety net to ensure that everything is okay. If you have any symptoms lasting more than 2 weeks, we want you to urgently contact us. This includes any enlarged lymph nodes, drenching night sweats, any fever, unexplained weight loss or a loss of your appetite, a skin rash or itchy skin, a persistent cough for more than 2 weeks or any shortness of breath, increased fatigue and tiredness, 2 or more infections in a 4-month period, or any new pain or unexplained discomfort. We will want to investigate why you are experiencing these symptoms, so we'll organise some extra blood tests and arrange to review you face-to-face in the clinic. Supported self-management puts you in control of your care and allows you to take an active and leading role in your health and well-being. There are lots of things you can do to look after your own health during and after cancer treatment. Many of these can be done without the involvement of your clinical team, such as physical activity and healthy eating. We advise that you follow a healthy lifestyle to reduce the risk of getting other health complications and health conditions. We acknowledge how difficult it can be to quit smoking. Smoking can be expensive as well as have significant detrimental effects on your overall health and that of your family. We are more than happy to discuss this further with you and signpost you to any resources to assist you. Your GP and any local pharmacy will also have access to local programs for support, and they can also refer you to these. Everyone should try to eat a healthy, balanced diet, but it is especially important when you are recovering from or living with cancer. This means eating a wide variety of foods in the right proportions and consuming the right amount of food and drink to achieve and maintain a healthy body weight. To achieve a healthy, balanced diet, you should try to eat plenty of fresh fruit and vegetables. Eat plenty of foods rich in fibre and starch. Avoid eating too many fatty foods, such as fast food or fried foods, and avoid having too many sugary foods and drinks. Avoid drinking excess amounts of alcohol, only drinking alcohol in moderation. In the long term, a healthy diet may reduce the chances of getting heart disease and diabetes, as well as certain types of cancer. Hand in hand with your healthy diet is also exercise. Physical activity is good for both your body and your mind. We advise you to try to gradually build up your exercise levels and have regular activity of 30 minutes 5 times a week. It has been shown to help prevent and manage over 20 chronic conditions, including cancer. You may need to build up gradually to this though. Going for a daily walk is a good starting point, and you can slowly increase how far you walk and how fast you walk each day. Other activities such as gardening, walking the dog, yoga, swimming, and cycling are all great forms of physical activity. It is also important to drink alcohol in moderation. For adults, the maximum recommended amount is 14 units of alcohol per week. Also, trying to have at least 2 alcohol-free days a week is a good idea. Again, we fully appreciate how difficult it can be to make change. And here on the screen, you can see a useful link that can be accessed for ongoing support. As you know, during your face-to-face follow-up with the Lymphoid team, they have been asking you about your dental health and when you last saw a dentist. It is recommended that you see a dentist annually as a minimum. Your dentist can assist you in promoting and maintaining good oral hygiene, detect and treat any early signs of gum disease or cavities, detect any oral cancer, assist you to stop any bad habits, conduct any panoramic x-rays as required, and generally catch any issues early before they become a problem. As we age, we will also be invited to participate in NHS screening programs. Screening programs can save lives by detecting early signs of cancer before symptoms have had a chance to develop. Catching it early also means that treatment is more likely to be successful. Most importantly, you know your body best, so we encourage you to contact your GP or the Lymphoid team if you notice any changes you are concerned about. We would also ask that you do let us know if you're being investigated for any other types of cancer. It is important to get health insurance when you travel. Unfortunately, some people can find this difficult if they have a cancer or after treatment for cancer. The Macmillan Cancer Information Centre at Southampton General Hospital and the Macmillan website have a list of insurers specialising in the insurance cover of those who have had cancer. Your lymphoid team are happy to write reports or letters to insurers to give details of your illness and treatment if required. If you are travelling to a warmer climate, it is important to use a sun protection factor 50 sun cream. Stay in the shade and wear a hat to protect your skin and reduce the risk of skin cancer. It is very important to keep vaccinations up to date. However, we will continue to advise that you do not receive live vaccines. Please do contact us if you have been recommended a live vaccine by your GP. Vaccinations are always improving, with access to a shingles non-live vaccine now available. It is also recommended you receive an annual flu vaccination and a seasonal COVID vaccine as well. For any non-urgent general inquiries, including test results, please use the messaging functionality on the My Medical Record. You should, however, be able to see your test results on your My Medical Record page. We aim to respond to these messages within 72 hours. For urgent inquiries and any new symptoms, please call us directly on the numbers on the screen. Please note that calls are picked up 9 to 5, Monday to Friday only. Out of these times and for emergencies, please call the acute oncology service. If you are experiencing a medical emergency, such as chest pain or shortness of breath, please call 999. You or a family member can then contact the lymphoid team after this to update us about what has happened. As we come to the close of this presentation, just to summarise, we will only offer you lymphoid PIFU if you have no active disease. You are not on any treatment and have no other complications at this time. It means you won't have any regular face-to-face clinic appointments, but we will continue to monitor your condition following your surveillance schedule. You can still get in contact if you have any concerns or worries, and we will discuss with you and triage you back to clinic as required. We do hope you feel more empowered to monitor any changes and self-manage to make positive changes to your health and well-being. Please be assured that your lymphoid clinical nurse specialist team is always contactable and here to support you. Thank you very much for listening, and please do contact us if you do have any questions.